Hello everyone, my name is Dr. Lee, or you can call me Philip. I don't mind, you can call me either one. I am pleased to be able to speak before you today and to talk to you about medical terminology. I am an acupuncturist and I have been practicing for 2 years. I am based in Fort Lauderdale, Florida. So thank you so much, and I will get started shortly. So to get started, I'd like to just let you know about the kind of groundwork or ground rules. What we will be doing is I will be talking the lecture for 1 hour, and if you have any questions, feel free to send by text on this WeChat and ask me your questions. I will get to them. Of course, the power of using technology is that if you have questions, even after the class is over, feel free to send those questions to me, and I will see them and respond when I get the chance during the day. Okay? So without further ado, I'm going to start. We're going to talk about medical terminology. Everyone has the PowerPoint. I am going to start on the slide number 3. It says body systems. So medical terminology basically is another language. So just like learning English or Chinese, once you understand the basic rules of the language, the different rules of the patterning of the different medical terms, this allows you to receive a lot of information. And it can help you, especially if you want to be in doing healthcare-related work, like if you want to be a doctor or an acupuncturist. There's a lot of medical terms that you should know, and so this is very important. I'm guessing this is why many of you want to take this course. I am going to talk now about slide 3, the body systems. So the body is made up of individual cells, okay? These are the individual units. Cells, when they come together and you group a whole bunch of them together, they're called tissues, Tissues. Now, many tissues can come together and they form organs, okay? And then many organs together, they form organ systems. So I gave an example here with the digestive system. So notice it contains many different organs, such as the mouth, the throat, esophagus, stomach, intestines, and they work together for a common purpose, for digestion. So this is the way that the body is organized. There are 11 body systems. So you can see them listed on the slide, so I don't have to read them to you, but you can see 1, 2, 3, all the way to 11. And these different systems coordinate, and they help the body to operate optimally. Now, basic medical terms. Signs are evidence of a condition such as a fever that can be observed. A sign is objective because it is evaluated by others. For example, when you're looking at someone's tongue, measuring their pulse, it's pretty objective because another doctor should be able to get the exact same signs from what you see. So if you see puffy tongue, another doctor should be able to note that as well. So that is a sign. And then listing here, there's several different signs. Atrophy is wasting away of tissue. Edema is accumulation of fluid in the tissue. Hypertrophy is overdevelopment of the size of an organ, and pyrexia is like a feverishness. Now note that hypothermia is a condition where the body temperature is below normal. Hyperpyrexia is a life-threatening high temperature. So you can see here the word pyre, right? Pyre means fire, okay? So fever, so pyre is like a root word. And we're going to talk about this shortly, about root words, prefixes, and suffixes. This is the basic ingredients of medical terminology and the constructing of medical terms. So to understand it, most important to know is the root word, and then the prefix or the suffix. And I'll explain that shortly. Now, there's different kinds of signs. One of the most important in medicine is the vital sign. So the vital sign refers to the signs that are important to note when you're assessing a patient, and these are basically about the most basic life functions of a human being. So they include temperature, pulse, respiration. Some people say that also blood pressure is one of them, which is another important one. And in America, we also say that the fifth vital sign is weight, because sometimes there can be medical conditions relating to overweight or even underweight, or even a drastic change in weight over a short period of time. Now I'm going to talk about symptoms. Symptoms are things that oftentimes it is the patient reporting to you, and it can be more subjective, which means that it is the patient's opinion or things that they feel that you cannot observe by measuring or touching or feeling or using your observational skills, such as listening, touch, or measurement with a machine. Some common symptoms here, as I listed: anorexia, loss of appetite; malaise, which means a vague sensation of not feeling well; nausea is stomach upset and feeling like you're going to throw up; tinnitus is ringing in the ears; vertigo is a type of spinning around or turning around sensation. Some people also call that dizziness, but they have slight differences. And then, so syndrome is a set of signs and symptoms together that is related to a specific disease process. So an example is carpal tunnel syndrome, okay? And symptoms include burning, tingling, pain, numbness because of compression of the nerve in the wrist, okay? Okay, now, diagnosis is the identification or the complaint or disease. So to diagnose is to reach a diagnosis. Differential diagnosis is a way to distinguish between two or more diseases with similar symptoms, and you compare the signs and symptoms. Prognosis is a prediction of the course or the outcome of a disorder. Acute is a condition that is rapidly occurring, has a severe course, and oftentimes occurs for a short time only. In contrast, chronic is a disease that occurs for a long time, or you have symptoms for a long time. Paroxysmal means sudden onset, and it occurs periodically. Remission is when the symptoms disappear, sometimes completely disappearing, but there's not a cure yet. And the word cure means health is restored, and then you're disease-free. So that's the definition of cure. Of course, some diseases are named for either the condition described, such as in chronic fatigue syndrome, when you're very fatigued or tired. And sometimes they're named after people or named after different acronyms or shorthand notations. So eponym, this term eponym, is a structured disease or something named after a person who described or maybe had the problem. One example is Parkinson's disease, named after a physician named James Parkinson in 1755. Acronym is a word developed from the initial letter or letters of the many words, like a sentence or a short term, like laser, LASER, and you can read that there. It stands for light amplification by stimulated emission of radiation. The term treatment is medical, surgical, or psychiatric measurement of a patient's disease or ailment. Active treatment, you try to achieve a cure. Systemic treatment, you direct toward the signs and symptoms of an illness. Palliative treatment means you try to take care of the signs and the bothersome symptoms, but it's not necessarily curing the issue. Prophylactic means you're trying to prevent something from happening. So people don't have to be sick, you are trying to prevent them from getting sick. In medical terminology, the term qualifier is an adjective or an adverb that makes the meaning of a term more specific. So two important ones are local and general, and then of course after general there's systemic as well. So local means only a small part of the body. For example, if you have a local anesthetic, like lidocaine for, say, tooth surgery, that is a local type of intervention. Then general means involves the entire body. Laughing gas is an example of a general anesthetic. It knocks you out. completely. So your whole body is kind of put out. Systemic also refers to the entire body. Oftentimes, like medications, like oral drugs, have systemic effects, means over the whole body. Transdermal means relating to the skin. Otic means relating to the ear. And those are kind of local effects. So that's in contrast to the systemic term. The next slide has a lot of useful words you can see. And these relate to different body parts. And I don't have to read this. I include a lot of information for you guys so that you can see yourself and review on your own time. But just for example, you can see like pelvo means pelvic, abdomen abdomen, vertebro means vertebra. So these terms, when you're familiar with them, it helps you give you a clue to what body part is being talked about. The term logy, or sometimes ology, is a word that means the study of, and this is a suffix. So it's a medical suffix. Ology at the end of the root word tells you that it means study of. So for example, here we have a whole list, cardiology. So cardio relates to the heart. That is the root word, cardio, for heart. You add on the suffix ology to that, and so then it becomes the study of the heart, cardiology. So this is the first use for me to you guys to show you how medical terminology, it works in action. Now let's talk about the basic root words, prefix, and suffixes. So it's like a jigsaw puzzle or like a different language, as I mentioned. There are three components of medical terms. Number one is the root word. So usually the root tells you what body part is involved. Like before in our example, we talked about cardiology, and cardio is the heart. So it tells you the body part. That is the root word. Suffix is usually representing the disorder or disease or condition or procedure. And the suffix is always at the end of the word. Prefix, generally, it talks about number or time, location, or status. And the prefix is always at the beginning of the word. So here's another example. See the word here? Electrocardiogram. Okay? So the root word here is cardio. Again, it means the heart. The prefix, or the beginning, electro, means electricity. The suffix in this case is ogram or gram, which means recording. So if you take these three parts together, you get an understanding that it's electricity, heart, record. So it's some sort of recording of the heart, and this device uses electricity to accomplish that. Or you can think of it as it records electrical work or activity of the heart. So this is how medical terminology can help you understand a complicated looking word. And in medical terminology, the key is to break up the word if you are unfamiliar, and then try to find the things that you do know. And once you do know it, you can break it up into manageable terms that you can then create meaning to and hopefully digest and translate into something that you understand in simple terms. Okay, here's another example, cardiomegaly. So the root word here is cardio, again, heart. Megaly is a medical suffix, or the ending, which means enlargement. So the meaning, if you put these two words together, is an abnormal enlargement of the heart. So this is a general method of how you understand medical terminology and how it works. Anyone have any questions at this point? I can go ahead and type if you do. And if anything's unclear, just let me know. Okay? Thank you. Okay, well, then to continue, here is another example. So the word gastroenteritis. So we have more than one root word sometimes. Here we have two. One root word is stomach or gastro, right? Entero or enteric is short for intestines. And then itis, I remember you guys learned in your previous class on Wednesday, itis means inflammation. So when you put these three words together, you see stomach, intestines, inflammation, and that is exactly what this is. Gastroenteritis is an inflammatory condition of the stomach and intestines. Now, there are many important suffixes. Remember, the word suffix, again, is added at the end, and it completes the term and tells you what's happening. So there are some that tell you kind of what it is pertaining to or what it is related to, okay? So gastric, IC ending, means pertaining to, and then, of course, the root word gastro means stomach, so that means pertaining to the stomach. Here is a short list of the different suffixes that have that meaning of pertaining to or relating to is the meaning. So you can see that list there, and I don't have to read over it. I gave you an example of gastric with the IC ending. Sometimes suffixes complete a word by changing the root word into the name of a person, a place, or a thing. In other words, it turns it into a noun. So another example here, cranium. So the word crani means skull. Turns this into a noun ending. So cranium is the part of the skull that houses the brain. And down here you can see other noun ending terms. Sometimes medical suffixes can mean a disease state or abnormal condition. For example, ism means a disease or abnormal condition, like hypothyroidism. So if you break this word down, again, the root word is thyroid, right? Ism is the suffix, which means an abnormal condition. Hypo is a term that means under. So under, thyroid, abnormal condition. So it's a condition where the thyroid is hypofunctioning or underfunctioning, underactive. And then at the bottom of the slide, there are other terms that you can see, other suffixes, like AGO all the way to OSIS, and you can review that on your own. Now, there are suffixes that relate to pathology, and they describe specific disease conditions. Algia means pain and suffering. Okay, dynia means pain. Itis, as you learned, means inflammation. Malacia means abnormal softening. Megaly means enlargement. Necrosis means death of tissue. Oragia means bursting forth, like hemorrhage. Urea means discharge or flowing. Sclerosis means an abnormal hardening, and stenosis means an abnormal narrowing. And then you can see I listed a bunch of examples. And if you want, I can pronounce some of these words, otherwise we can move on. I'll give you a couple seconds to let me know. Thank you. Some suffixes relate to procedures. So centesis is a surgical puncturing to remove fluid, like peritoneocentesis. So peritoneum is a structure that surrounds the organs and provides support. Okay, centesis is that puncturing procedure. So peritoneocentesis. Ectomy is a term that means to remove surgically. Hysterectomy means to remove the uterus. Again, hystero is a root word that means uterus. Ectomy is that term for surgical removal. Graphy means the process of recording. Okay? Gram is a picture or record, or record sometimes. Lysis means to loosen, free, or destroy. Oraphy means repair, closing, or suturing. Plasty means to repair surgically. Scopy means to visually examine. And stomy or ostomy means to form an opening. Now that we finished talking about suffixes, let's start talking about prefixes. So a prefix is a small word added to the beginning of the word to change the meaning. So prefixes indicate time, number, color, or even location. So here are some examples. Prenatal means it encompasses the time before birth. Perinatal refers to the time surrounding birth. Postnatal is the time or events after birth. So here the root word is natal, which means birth. And then the prefixes here in these examples are pre, peri, and post, meaning before, during or around, and then after. There are a lot of prefixes that deal with contrast, kind of like yin and yang. So sub means less, under, or below. An example is submandibular, below the mandible. Supra means excessive or above. So supraclavicular means above the clavicle. The clavicle is the collarbone. Inter means between. There are a lot of prefixes that deal with contrast, kind of like yin and yang. So sub means less, under, or below. An example is submandibular, below the mandible. Supra means excessive or above. So supraclavicular means above the clavicle. The clavicle is the collarbone. Inter means between or among. So interdigital means between the digits, meaning between the fingers. Intra means within or inside. So intramuscular means within the muscle. Hyper means over or above, excess or increased. Hypertension is high blood pressure. Hypotension means lower than normal blood pressure, so below hypo. Sometimes it can mean decreased or deficient. The word dys, dys, means bad, painful, or difficult. So dysmenorrhea is a word that means bad or painful menstruation. EU means good, normal, or easy. So euthyroid means a normally functioning thyroid gland. Ab means away from. So in the medical term abduction, it means to move your limb away from the central axis of the body. Ad means in the direction of or toward. Sometimes it means toward the axis, toward the midline. So adduction means the movement of the limb towards the axis of the body, towards the midline of the body. There are also prefixes that relate to number of things. So uni or mono means one or single. Primi or primi means first. Bi or di means double or two. Tri is three. Quadri or tetra means four. Hemi or semi means half. Multi means multiple. Poly means many. Oligo means scant or few. Pan means all. There are also prefixes that relate to color. So, as you can see on the list here, alb or albo means white. Chlor or chloro is green. Cyan or cyano means blue. Erythro means red. Leuco is white. Melano is black. Purpur means purple. Ruby is red. Xantho means yellow. The next slide goes over the commonly used prefixes. So a or an means not. It can mean no. It can mean without. Anti means before. Anti or contra means against. Out or auto means self. D means down or without. Dextro means right. Dia, per, or trans means complete or through. Endo means within. Ek or ecto means out or outside. Exo also can mean outside, away from. Hetero means other or different. Homo means the same or unchanging. Meso can mean middle. Mega or macro can mean large. Micro means small. Neo means new. Normo means normal. Peri means around. Pre or pro means before. Poikilo means varied or irregular. Post means after or behind. Pseudo means false. Re means back or again. Retro means behind. Sub means under or below. Syn or sim means together. Tele or tello means end. Trans means across or through. Sinister means left. Now, in terms of body orientation and what is up and what is down, this relates to anatomy and physiology. So anatomy is the study of the bodily structure, whereas in contrast, physiology is the study of the body's functioning. The anatomic position is the standard position of reference used to describe the sites or the motions of the various parts of the body. In the anatomical position, the body is erect and facing forward. The arms are at the sides, and the hands are turned, palms facing the front. The next slide shows the medical terms used to describe the body's directions. Anterior means in front. For example, the sternum is anterior to the heart. Caudal means toward the tail or lower part of the body. The coccyx or tailbone is caudal relative to the cranium, which is the skull bone. Cephalic or cephalo means toward the head. Distal means farther from the midline or point of reference. Usually it's the trunk. For example, the distal end of the femur is part of the knee. So the femur is that huge long bone in your thigh, okay? So the distal end forms part of the knee. Dorsal is a term that refers to the back of the body or organ. It means posterior to. Inferior means the lowermost, below, or toward the feet. The shoulders, for example, are inferior to or below the head. Posterior means situated in the back. For example, the heart is posterior or behind the sternum. Proximal is a term that means near the midline or point of reference. Again, remember the trunk or the body. The proximal end of the femur forms part of the hip. Medial is a term that refers to the midline. So the medial part of the ankle is near the inner surface of the leg and foot. Lateral means the direction toward or near the side and away from the midline. So the lateral part of the ankle is near the side of the leg and foot. Superior means uppermost, above, or toward the head. So, of course, the head is superior to the shoulders. Ventral is a term relating to the position toward the belly, along the front, and anterior also. Within the human body, there are several cavities, or spaces, and they contain organs. There are 5 major ones: spinal cavity, cranial cavity, the chest or thoracic cavity, abdominal cavity, and pelvic cavity, and they contain different organs. On the next slide, I mention the planes of the body. So a plane is an imaginary flat surface, and organs appear in a relationship to each other according to the plane of the body in which they are analyzed. So the frontal plane divides the body or organ into front and back, anterior or posterior. Most X-rays are done in the frontal plane. Sagittal or lateral plane divides the body into right and left halves. A lateral X-ray will show the body part in the sagittal or lateral plane. Transverse or horizontal plane divides the body into an upper and a lower half, just like a cross section. So a CT scan does this transverse plane. Now, the abdomen can be divided into different quadrants. So if you use the umbilicus or belly button as the center of reference, you can make a vertical and a horizontal line, which will divide the abdomen into 4 quadrants. Again, the word quad means 4. So there are 4 sections. There's a right upper quadrant, there's a left upper quadrant, right lower quadrant, and a left lower quadrant. Another way to divide the abdomen and thorax is into 9 divisions. So in this next slide you can see, and they're labeled as well. So there's a right and left hypogastric region. There's an epigastric region, which is in the top center. The very middle is the umbilical region, including the belly button. There's a left and right lumbar. There's a hypogastric. And then there's a right and left inguinal. These terms are important because that allows you to describe a location of where pain is, or where certain organs are located, or certain signs or symptoms are relating to. So these 9 regions are very useful, and the terminology for these is very important. I already used this medical term, but peritoneum is the membrane that supports and protects the abdominal cavity organs. There's a parietal peritoneum, which is the layer of the peritoneum that lines the abdominal cavity. The visceral peritoneum is an inner layer of the peritoneum that encloses the organs of the peritoneum. Mesentery is the layer of the peritoneum that suspends part of the intestines within the abdominal cavity. Retroperitoneal means located in the abdominal cavity behind the peritoneum. Peritonitis is an inflammation of the peritoneum. Ascites is an abnormal clear or serous fluid in the peritoneal cavity. Now, for some medical terms relating to the human body in health and disease. Cytology is, again, ology is study of. Cytes or cyto means cells. So this means the study of cells, the basic structural units of the body, which come together to form tissues and organs. So a membrane is a thin layer of tissue that covers a surface. It lines a cavity or a separated space. The cell membrane surrounds and protects the cell. Cytoplasm is the contents within the cell membrane except for the nucleus. The nucleus is the central controlling body within the cell, and it controls the activities of the cell, allowing it to divide and reproduce. Histology is the science dealing with the microscopic identification of cells and tissue and the structure and composition of organ tissues. So there are 4 main types of tissues: epithelial, connective, muscle, and nerve. Epithelial tissues. All of the internal and external surfaces of the body are covered by epithelial tissues. So the epithelium is a specialized structure, and it creates the epidermis of the skin and the surface layers of the mucous membranes. The endothelium is the epithelial tissue lining the lymph and blood vessels, body cavities, glands, and organs. Glands are made of secretions producing from the epithelial tissues. Connective tissues lend support and connect organs and other body systems. Bones and cartilage are dense connective tissues. Adipose tissue, or fatty tissue, provides insulation, padding, and support, and acts as nutrient storage. The term addy means fat, pos means pertaining to. Nerve cells and blood vessels are supported and surrounded by the loose connective tissue. Blood and lymph is a liquid type of connective tissue. So that's an interesting fact that blood and lymph fluid are actually considered connective tissues as well. Next, we have muscle tissue. So muscle tissue contains cell substances with the ability to contract and relax. So the cardiac is a striated involuntary muscle. Skeletal muscle is striated and voluntary. So the term striated means striped or stripy. Then the other type is called smooth or visceral, means non-striated, involuntary. So again, it's not striped. Involuntary means you do not have control over. Voluntary means you do have control. Next, I talk about nerve tissue. So nerve tissue contains specialized cells with the ability to react to stimuli and conduct electrical impulse. So neuroglia are the supporting neurons, and neurons are nerve cells, and they conduct electrical impulses. Pathology. So again, here, ology means the study of. Patho means disease. So here the root word, patho means disease. Ology is the suffix that means pertaining to. So here's another medical term. Pathology is the study of changes in the body produced by disease. A pathologist is a person who studies these things. Etiology is the study of the cause of disease. So in other words, the root word, etio, means the cause of something, and particularly disease. And ology is the study of it. With regard to diseases, there are many types. So infectious disease is an illness caused by a pathogenic factor or communicable organism, meaning an organism that can be transmitted from one to another. Idiopathic means an illness without a known cause. Organic means a condition that accounts for a patient's symptoms, and it's a physical change, so that's what organic means. A functional disorder means there's no physical change to account for the patient's symptoms. Iatrogenic disease or illness is an adverse response to medical treatment provided for a disorder. So if you have a hospital-acquired infection that was not there before going to the hospital, it's called nosocomial infection. There is pathology of tissue formation. So aplasia or aplasia is the lack of development of an organ or tissue. Hypoplasia means the incomplete development of an organ or tissue. Hyperplasia means an abnormal increase in the number of normal tissue or normal cells in a tissue. Dysplasia is abnormal development or growth of cells, and anaplasia means a change in the structure of cells and their direction to each other. There are terms relating to transmission of disease or spread of disease. Communicable or contagious diseases are diseases that are transmitted directly or indirectly from object to person or person to person. Contaminated means the probable presence of an infectious agent, a condition of being soiled, stained, touched, or otherwise exposed to harmful agents makes an object potentially unsafe. Sexually transmitted disease, or STD, it can sometimes be known as venereal disease. Sometimes they use VD as a short for this term. It's a contagious disease usually acquired by sexual intercourse or genital contact, and these diseases are the most common communicable diseases. Airborne transmission means illness that is spread through respiratory droplets, such as the common cold and influenza or flu. There are also food and water-borne transmission, or fecal-oral transmission. Illness can be caused by eating or drinking contaminated food or water that has not been prepared properly to remove the toxins. Now, there are also terminologies dealing with the outbreak of disease. Endemic is the ongoing presence of a disease within a population or area. Epidemic is a term that refers to the sudden and widespread outbreak of a disease within a population or an area. Pandemic means occurring over a large geographical area. Epidemiologist is a specialist who studies the outbreaks of disease within a population or an area. And finally, medical specialists. So medical specialists, the word IST here, the suffix, deals with a person who specializes in something. And here is a long, long list that shows from allergist all the way to urologist, medical specialty providers. So an allergist, for example, treats hypersensitivity or allergy conditions. A urologist is a person, a specialist, who deals with surgery relating to the urinary tract. So the word uro, right, means urine. Ologist is a person who studies, because the word ology means to study. So this is my first lecture, and it goes over these basics here. I gave you an introduction of prefixes, suffixes, and root words, and I taught you guys how to think about medical terminology and how you need to approach forming words when they are very complicated. You chop it up into easy to manage, smaller words, and then you can put it together and make understanding. My purpose today was also to give you an understanding of a lot of the medical related terms and kind of like a background introduction to give you a knowledge about things like vital signs, other medical terms that are commonly used, and to be familiar with different kinds of tissues and organs. I understand that today's lecture sometimes got a little complicated and the words maybe were very big, but all this material is in your hands and for you to reference and study on your own time. So that can be your homework, to go over all this material and to review. And if you have any questions, feel free to ask me. So it looks like I finished a little early because it is about 8:50 now. I can use this opportunity in the last 10 minutes. If you have any questions or want me to go back to a slide that maybe was confusing to you or some words, this is your time to ask me. Okay, I'll let you guys ask questions. It doesn't have to be within the session, but anytime you have questions, feel free to text to me, and I will be happy to answer them anytime. Next class, I will have another lecture, and I will provide it and make it available to you at least one day before, so that you can look at it a little bit before I talk about it. So for sure, I will send to you. Thank you, everybody. And you've taken your first few steps into a very large world, the medical world. And when you understand medical terminology, in conclusion, I'd like to say that you really begin to understand and break down these difficult terms and make them very simple, actually. So it puts you in a special place, and you're among people that understand very complicated language. But as you can see, as you learn this medical terminology, you begin to find out that it's not so complicated after all.
Hi, Philip. I have a question. I think most of students, they all want to have more chances to practice. Can you leave us more time to practice, like oral medical English or some conversation in hospital or clinic? Could you do?
Good question. Yeah, I included a lot, maybe too much medical terminology and a lot of different words within this PowerPoint. But I don't want you guys to be intimidated or, feel nervous, because this information now seems hard, but you can use it anytime, and you have plenty of time to study. Every day you should be studying medical terminology, even between classes. And so this is